Tonight on WAMN News, demanding answers, claims of discrimination after a disabled woman is continually denied rides by taxi drivers. A WAMN News exclusive.
Opposition responds to a public hospital midwife's frustrations following an exclusive interview.
Football frenzy hits Western Australia as Britain's top 4 soccer teams battle out in Perth.
5 years worth of fun. Youth Jam Radio celebrates its 5th anniversary, and later Dr. Andrew Miller's comment.
This is The Evening News with Ivan Loom and Maliva Thorne.
Good evening. A woman with a disability is demanding answers after 4 taxi drivers refused her service at a taxi rank where she was seeking transport home. The incident has left the woman deeply upset with a prominent Perth taxi service, and the state opposition says she has potentially been discriminated against. Nelson Liu with this exclusive report.
A simple trip home turning into a nightmare for a woman in need, let down by a WA taxi service.
It's terrible. It's terrible.
Ros suffers from poor mobility but remains independent, using a stroller and relying on cabs to commute across Perth. But her trip to Victoria Park was made more difficult by Swan taxis. She was returning from Perth CBD on Saturday afternoon last weekend, her trip taking her to Crown Casino where she attempted to catch a taxi, but she was refused rides from drivers.
Managed a bus and a train to the taxi rank at the Crown, and I was refused by 4 taxi drivers at the rank.
Also on a support pension, Ros uses taxi vouchers for her trips, but they were rejected.
Taxi drivers don't like using the voucher book because they don't like filling it out.
Ros managed to get a taxi home at 7:20 p.m, finally accepted by a driver at Crown. She has since made a complaint to Swan Taxis. However, she continues to experience difficulties with long wait times. Ros says since her incidents, she's discovered taxi drivers are required to provide rides to people with a disability. She claims she's been discriminated against. The state opposition has heard her concerns.
Outline her circumstances because I certainly would be quite keen to learn exactly why she's been refused.
They believe more specialised taxis are needed to help people like Ros.
And more could be done to ensure that taxis that can take people with wheelchair needs and other disability access issues are available.
Meanwhile, Swan Taxis have responded to the incident. In a statement, the company says, "We have reached out to the individual who made a complaint and we have apologised for the lack of service experienced. And we understand the importance TUS plays in a community, and we endeavour to ensure that all drivers are aware of their responsibility to provide service when presented with a TUS voucher." Ros says people in need should be treated better.
This could do with a little bit of help with some training before they get in a taxi.
Nelson Liu, WAMN News.
There are calls for better support for midwives after a public hospital worker blew a whistle through this program last week. The exclusive interview with Sue, a midwife who's frustrated over delays in the reopening of Bentley Hospital's maternity unit, has sparked a reaction from prominent politicians. The opposition's Shadow Health Minister Libby Mettam joins me now. Libby, thanks for joining us. What do you make of the public hospital midwife's comments on our program? Do you acknowledge her concerns and frustrations?
The concerns raised by the midwife on WAMN News is very concerning, and the fact that she's not being utilised for midwifery work also raises real questions, given that we know that there is a significant shortage of midwives across the state at this time, at a time where we're actually seeing services being cut back, whether that's in Carnarvon or whether it's at Bentley as well. We have asked a number of questions in Parliament around this. It was concerning to hear about the number of maternity bypasses that happened last winter at hospitals around the state.
This issue goes back to midwife shortages, and the McGowan government is seeking midwives from overseas to fill jobs. What needs to be done to resolve the crisis now?
It's understandable that given the shortage of midwives that we are seeing across the state at this time and the crisis in the delivery of maternity services, that the government is doing more, or at least making efforts now to try to attract midwives from overseas. But we also do need to support the midwives that we currently have in the health system. We need to better support the midwives who are currently working in our health system now, so that they can better support our existing and future parents and those pregnant women.
The midwife who went public on our program says Bentley Hospital mainly serves culturally and linguistically diverse women giving birth, with culled staff equipped to assist. This is no longer available, so what should the government do to support the mothers?
Birth choices are vitally important. I appreciate that the Bentley maternity unit was particularly important for individuals because it was a local service for many in that area, but it also supported the more unique, linguistically diverse population as well. And the absence of this service, the fact that it has effectively been put on hold now for more than 2 years, raises real questions about the McGowan government's attitude towards ensuring that there are choices and options for women when it comes to giving birth.
Libby Medham, thanks for your time.
Thank you. And it's really good to be talking to WAMN about this important issue.
Perth fans of the World Game have been whipped into a frenzy, with English Premier League superstar teams heading down under for a festival of international football. Manchester United, Crystal Palace, Leeds United and Aston Villa touched down in Perth during the week for a weekend of exhibition matches in preparation for the new season. The teams faced off against each other in 2 friendly matches on Friday and Saturday, attracting nearly 100,000 spectators to the games. Football fans have also been treated to opportunities to meet their favourite players, including open training sessions and fan events throughout the city.
What I always like from Australia, and I smell it in Melbourne and you smell it here in Perth as well, that is the sports culture. It's really important for this country. I think it out of top sport, but also I think the part of socialize. And I think those two, the Aussies, they really could are really good connected with that, and their attitude, mentality.
Speed and high-risk driving behaviours will be targeted with new mobile point-to-point cameras to boost safety on WA roads. The safety cameras were revealed on Wednesday in a $1.5 million trial, with 6 cameras working in pairs to detect average speed, mobile phone usage and seatbelt use. They'll be trialled on a variety of roads in metropolitan Perth as well as regional WA. Police Minister Paul Papalia says the cameras are part of their commitment to reduce the number of fatalities and injuries on WA roads.
Look, it's really exciting. This is, as I understand it, the first time in the world where the 3 capabilities or 4 capabilities have been pulled together into one lot of machinery. So it's great that WA is leading the way. We're really keen to see what the outcome of this trial is.
Concerns over the foot-and-mouth disease continues as the federal government began new biosecurity measures in international airports around the country. The new biosecurity response areas are set up, and every traveller from Indonesia will need to use foot mats and comply to directions to safeguard Australia's biosecurity. This means passengers who are deemed as risks need to have their shoes cleaned and use foot mats. Meanwhile, WA's Agriculture Minister Alana McTiernan was slammed trivialising comments on FMD earlier this week.
As the cost of living remains high for many Australian families, the issue of household debt also plays a big role in causing stress to family budgets. With interest rates set to increase even further, there are concerns that personal finance will cause further pain for households. Certified mortgage broker Justin Ong says it's important for people to make careful assessments before making commitments to personal credits.
Management is a big topic. If you do have the discipline to manage the way you repay like a lot of people do. They use their credit cards for daily expenses, but by the end of the month or by the end of the cycle, they pay off the debts straight up. So they don't end up paying any interest at all. They don't carry forward their amount owed. If you don't have the discipline and you can't commit to paying it off as soon as possible, if not right away, don't do it.
Perth's young people gathered to celebrate a big milestone, with Youth Jam Radio hosted a party to mark the station's 5th anniversary this weekend. The independent online radio station has become an advocate for young people, at the same time creating media opportunities. The station's founder and operator, Isaac Macron, rejoiced over the achievement, saying the milestone signifies that young people have the power to change things for the better.
Just thank you. I thank you everyone for listening to Youth Jam across the last 5 years, for donating if they have, for being a part of the community, but also just liking a post, sharing a post, commenting on a post. It all counts and it all gets Youth Jam out there. So just thank you to everyone who's watching or listening to Youth Jam or WAMN News. Just a thank you for just being a part of this community.
Congratulations to Isaac and all the team at Youth Jam for your years of hard work.
And speaking of hard work, Melly, next year is our 10th anniversary.
Gee,
10 years
flies.
worth of WAMN news, yes? I
Time
think,
flies.
well, if Youth Jam throws a great party, we have to throw one that is
even bigger.
even bigger one, because, double the age, double the fun, right?
Yeah.
And now, here's AMA-WA spokesman, Dr. Andrew Miller, with his weekly COVID-19 update and medical commentary.
Hi, thanks for your time. We continue to see huge stress on our hospital system with essentially the same number of beds as Royal Perth has now being taken out of circulation by COVID disease. And we know that there's big numbers spreading in the community, and we know that BA5 does not generate a great deal of immunity, unfortunately. We're seeing people getting reinfected after 30 days or so. So this is not a one and done situation, and we need to remain very careful to reduce transmission. So the government are saying that they encourage us to wear masks, but they're leaving it up to people when to do that, which means that nobody's doing it on a significant level and no one's really worrying too much about it, because I think West Australians are very compliant with government requirements to do things, but if it's not required, then people think it can't be that important, so they don't bother doing it. So it's a time for the government to step up and say, listen, we can't have our hospital system constantly filled with this number of patients. We don't want to see this amount of disease and suffering. And we do need to cut the transmission so that we can allow people who have immunocompromised and elderly people to circulate in the community normally. And that means that the rest of us take the responsibility of trying to protect them by wearing masks and improving ventilation around the place. Monkeypox has been declared by the WHO as a public health emergency around the world. It does have a rate of severe disease. The good news with that one is that vaccination, and similar to the one or the same as the one used for smallpox previously, can be used also for this disease, and does in fact work even around the time of exposure or after, so that it's an easier disease to control if we have the will and the wherewithal and people don't decide it's all just too much and I'm too tired to bother with it. So the governments are keeping a careful eye on it. It will grow exponentially. It is spreading around the world, and hopefully much easier contained using fairly straightforward public health methods, and we'll get onto that one soon. And this is evidence again that just because the situation's bad with COVID doesn't mean something else can't come along and cause further complications, and we have to keep our minds open and our eye on the ball as far as controlling these kind of public health threats. Good news is we have all the tools to do it. We just need the political decisions and the resources to be put into it, because as in the case of COVID, we certainly can't afford just to pretend that it's gone away, because that will see a much bigger clean-up job afterwards. Just like with all problems you have, whether it's weed in your garden or bushfire, things that are grow exponentially, if you don't control them early, then it's a much more difficult job to sort it out later on. Thanks for your time.
That was Dr. Andrew Miller. Now, here's Leo with what's coming up on 6 News tonight.
Thanks, guys. It on 6 News. The Parliament set to return in just under 48 hours. Anthony Albanese's government unveiling a to-do list. They've got the numbers in the House, but in the Senate, they can't pass anything without the support of crossbenchers or, alternatively, the coalition. Plus, the deadline for parties to apply for registration with the VEC in Victoria fast approaches. We speak to Independent MP Catherine Cumming about why she set up the Independence Party. And UK Conservative Party members seem to be favouring Liz Truss to become the next UK Prime Minister, but voters appear to be looking towards Rishi Sunak. We've got details on that and plenty more coming up on our YouTube channel right now. They're all available there and on our website, 6newsau.com.
Thanks, Leo, and that's our weekly news and current affairs. We have the latest news on our website, wamnnews.com.au.
Don't forget to subscribe to the WAMN Extra News Club so we can continue our work in the community. Full details on wamnews.com.au/news/extra. From Melly and myself, we wish you good health, good night. See you next Sunday.
Thanks for watching.